Let's talk about ways that you can test your blood glucose levels. Traditionally, you can get a blood draw to see what your serum fasting plasma glucose level is or your hemoglobin A1C. But the cool part of technology is we can now do some of those things from home. The easiest way to test your blood glucose levels is with a glucose meter. Traditionally, you needed some sort of prescription from your doctor to do this, but now we see things like our new BioCoach meter that allow you to test your glucose and ketone levels at home. With these types of meters, you do have to poke your finger using a lancet and provide a small sample of blood to the meter with the testing strips to see what your blood glucose level is. We suggest testing multiple times per day, knowing what your fasting blood glucose level is without eating for approximately 12 hours, and then testing after your meals to see how your body responds to the foods that you're eating. We define normal fasting plasma glucose levels as anything less than 100. If you get fasting plasma glucose levels 100 to 126, that's considered pre-diabetic range, and anything over 126 on a fasting glucose check is considered diabetes. A random blood glucose to spike whenever you ate last over 200 is highly concerning for a diagnosis of diabetes, either type 1 or type 2. The other thing that you can do with these meters is check your ketone levels. So we have two fuel sources in the body, glucose and ketones. As we start using a smaller percentage of our energy from glucose, we increase our energy utilization from ketone bodies. There's 3 ketone bodies that can be present in the bloodstream, but the most common one is BHB, or beta-hydroxybutyrate. The BioCoach meter does allow for testing of BHB. We define ketone levels to be in a level of therapeutic ketosis between 0.5 millimoles and 5.0 millimoles. It is possible to get ketone levels over 5, but with a functioning pancreas, it's not concerning. People that are more metabolically broken or just starting something like a low-carb or ketogenic diet will tend to register higher levels of ketones. If you ever see a glucose level well over 200 with high ketones, that's highly concerning for something called diabetic ketoacidosis, and you'll want to seek medical attention immediately. Let's talk about what CGMs are, or continuous glucose monitor. Traditionally, most people tested by poking their finger to see what their blood glucose level was. CGMs are something that was typically used among insulin-dependent diabetics, but we're now seeing widespread use with common consumers to see how your body responds to the foods that you're eating. Now, there are differences between continuous glucose monitors and testing by poking your finger. By poking your finger, you're actually measuring the blood levels of your glucose. With continuous glucose monitors applied somewhere on the body, usually the abdomen or the back of the arm, it's actually measuring something called interstitial fluid. So you need to understand the difference because the numbers will not always correlate at the same time. Interstitial fluid is this little layer of fluid right underneath our cells, and it is about a 5 to 10 to 15 minute delay in a blood glucose rise with interstitial measuring. So if you were to poke your finger and look at your continuous glucose monitor at the same time, there would be a difference in the rise of the blood glucose after the meal. It would be delayed on the CGM by up to 5 to 15 minutes. Continuous glucose monitors are great because they're less invasive. You don't have to poke your finger all the time, but they're not as widely available as traditional testing like this monitor from BioCoach.